But what are the challenges? One of the big challenges is that fluid takes place during and outside meals. If you've got a methodology which focuses on meals, then it becomes much more difficult. In the UK, we only consume 31% of fluids during a meal. In Germany, it's 61%, and it varies considerably around the world. The type of fluid within and during a meal will also vary. I don't know if you've looked at the supplement yet, but you will see some of this more recent data presented there. Indonesia, they drink, because of the climate, and also they have a very good policy about promoting water. I think they do drink a lot of water. They actually have a high fluid intake, but most of that, 80% of that, is also water. If you looked at the data for the UK, it would be mainly tea and coffee. What about social occasions? How many of you sat there and had a meal with colleagues and friends last night? It's okay when you have a bottle, like one of these bottles. Oh, I had 3 of those today. You're sharing a bottle. You're sharing a jug. Someone tops up your jug. How much was in your glass? How much was in there before you started? How much have you drunk? These are some of the challenges which you have with fluid intake, which you don't have with food, because you tend to either serve yourself or it's plated for you, in which case you automatically have that recognition of what was in front of you and who drank what and how much. And of course, the more alcohol you drink, the less reliable it probably gets. This is my family. This is the beginning of a birthday party celebration, very sedate. That's the second bottle of wine, I will add. I think we got through 4 bottles of wine that night. Plus, as you can see, my son-in-law is knocking back a beer. I don't know how much I drank that night, but I do know I was fairly sober before I went to bed, before anyone making any judgments on me. But there was another factor. My granddaughter, she decided to get in on the act and picked up a bottle of Evian. And I assure you, this was not posed. She just did it. And we poured some of that water into her beaker, and she joined in. So I hope you get my messages. It's extremely difficult in social situations to estimate how much fluid you have consumed. Depending on what tool you use, you will get different results. This is a comparison between 2 methodologies. The one on the left is the fluid-specific diary, which you're going to hear a lot more about. And as you can see, the volume's larger. And there's a difference within there of the fluid types. And in fact, this emphasizes those differences. And it's the number of events was 1.5. An average glass is 200 mils. So you're talking about 200 to 300 mils as being missed. The pattern will vary during the week. And this is more data which Isabel has produced from the Liquin 7 study, which we're going to hear more about. The first line, let me go back, is the average. We then can superimpose one group of people who consume more on a Thursday and Friday, and then it tails off. That sounds like my son. Others who, they wait till Saturday. And the asterisk is to signify there are significant differences between those 2 patterns. And then we have another group who obviously cut back at weekends. But we've got to superimpose on this working patterns. It might be that they're in an environment where they need to drink more. There's so many factors that can influence this. This is Dr. Bardazzono Tati's work. And as you can see, she used a crossover study to compare a 7-day fluid diary and 24-hour recall. And the mean difference over this study was actually nearly 400 mils. So the 24-hour recall is underestimating considerably compared with the fluid diary. And it gets worse with the higher drinkers. So the key issues are really nutrition surveys are food surveys. They are not designed necessarily to capture water. And we've got to get better at this.